Speaker 32, please come to the microphone. Please state your name and any organization you're representing for the record.
My name is Allison Dwyer Willis. I am the mother of Jack and Nolan Willis, patients number 9 and 10 of the original 12 Sarepta clinical trial participants. Before I speak, I think you should hear from them since they are two of the most important voices in the room today.
My name is Jack Willis, and I am patient number 9 in the Sarepta trial.
My name is Nolan Willis, and I'm patient number 10 in the Sarepta trial.
We have chosen to dedicate the last 5 years of our lives to this clinical trial, quite willingly. Since we have lost the ability to walk, we have been labeled as the failures of the Eteplirsen trial. We come here today not only to show you that we are not failures, but to claim victory.
We claim victory because our lives improved while on drug. Our hearts and lungs performed normally. We had some increase in strength. We notice when we have to skip a dose. We are more tired and lethargic. We know this drug will keep us alive longer.
Duchenne patients don't die from not walking. They die from heart and lung failure. We are almost 15 years old with normal function, something which is not necessarily normal for other Duchenne kids our age. We did not have one side effect while we have been on Eteplirsen.
We are not outliers. We have followed the natural progression of Duchenne, which has now changed due to Eteplirsen. Even though we stopped walking 4 years ago, we are still able to pick up books off the table, feed ourselves independently, drink without a straw, and brush our teeth without help.
We are not failures because we stopped walking. Please stop calling us that. This drug not only preserves the ambulation. This drug is not only to preserve ambulation, like we said. You don't die from Duchenne by not being able to walk. Maybe had we been on drugs sooner, we would still be walking. Why would you make other boys wait when this drug could allow them to walk longer, to feed themselves longer, to hug their parents longer, to live longer?
I was nervous that the boys would not qualify for this trial, knowing that Nolan's ambulation was already rapidly declining. Our goal for this trial was not to preserve ambulation. It was to preserve their quality of life and allow them to live longer, period. Nolan took his last steps in February of 2012, and Jack joined him in June of that year. They fought hard to stay on their feet, as their walking days were really gone before they even started the trial. My boys became known as the kids who were making the data messy, who declined in the 6-minute walk test, who lost ambulation, and everyone began to question if the drug was working. My boys make the data stronger because they are responders. They are making dystrophin. The drug is working in them. The production of dystrophin has changed the trajectory of their disease. My boys regained some upper arm and torso strength, were less fatigued, and regained some of their independence that had been lost. In their case, loss of ability to walk independently has still not preceded a decline in pulmonary function. Thanks to Eteplirsen, both of my boys are experiencing a clear deviation from the natural disease course. My son should give the ADCOM panel members confidence that the drug is working in both ambulatory and non-ambulatory boys. Both populations will benefit from the approval of Eteplirsen. Thank you.